All right, everyone, get ready because today we are going deep into the world of cardiometabolic clinics. And I have a feeling this is going to be a real eye-opener when it comes to heart health.
Yeah, you're absolutely right. We're seeing a really interesting shift towards early detection and prevention. And get this, even for people who seem, perfectly healthy.
That's what really grabbed my attention, too. This goes way beyond just treating heart disease after it's already developed.
Yep.
This is about identifying those hidden risks and nipping problems in the bud before they even start.
Exactly. And that's precisely where these specialist clinics are making a huge difference. They are really embracing this multidisciplinary approach, bringing together cardiologists, diabetologists, nutrition experts, you name it, even psychologists, to get a truly complete picture of each patient.
Okay, yeah, that definitely sounds different from your typical visit to the doctor. But let's just back up for a sec. Can you break down what a cardiometabolic clinic actually is? And why is this kind of approach so important these days?
Okay, so think of it as like a one-stop shop for all things heart and metabolic health. And the key here, the real connection, is that heart disease and metabolic disorders, things like type 2 diabetes, they're often very closely linked. They share a lot of the same risk factors and can develop silently over many, many years, just like coronary heart disease,
So you're saying someone might not even know anything is wrong until it's too late?
That's the real danger here. Way too many people only find out they have a problem when those serious complications start popping up, like a heart attack or a stroke.
Yeah.
And by that point, there could be significant damage already done.
Okay, that's kind of unsettling. So how did these clinics actually help with early detection? Are we talking about new tests, new technology?
Oh, absolutely. We'll get into those specifics a bit later. But yeah, they're utilizing some really advanced diagnostic tools that can uncover those hidden risks long before any traditional tests would even pick them up.
All right, okay, now you've really got me intrigued. Can you give us a quick example?
Sure. Let's talk about glucose dysregulation. Basically, how well your body handles sugar. It's well known that problems with glucose control are a major driver of both type 2 diabetes and heart disease.
Right. And usually we rely on that HbA1c test to check for that, right?
Yeah, that's the standard go-to test. But it only gives you an average blood sugar level over the past couple of months. What's really cool now is that there are these newer tests that can detect even the tiniest issues with glucose regulation, issues that wouldn't even show up on an HbA1c for years.
So we're talking about potentially catching those warning signs years earlier than we used to.
Exactly, precisely. And this kind of early detection, it's particularly crucial for folks who might be predisposed to something like carbohydrate sensitivity. They might seem totally fine based on their HbA1c, but in reality, they could be on that path towards prediabetes or even full-blown type 2 diabetes without even realizing it.
Wow. That's really eye-opening. It sounds like these cardiometabolic clinics are really filling in a massive gap in our healthcare system.
Yeah, I think they are. And to give you a real sense of how this all works in the real world, let's look at a specific case study from a place called the Surrey Cardiovascular Clinic, SCVC for short. They're doing some really impressive work in this area.
Okay, perfect. I always love seeing how these things play out in real life. Tell me about this clinic. What's it like?
SCVC is a great example of this whole multidisciplinary approach in action. They've got a whole team. Cardiologists, diabetologists, specialist nurses, you've got nutritional therapists, exercise physiologists. They even have psychologists all working together there.
Wow, that's an impressive team. What makes their approach so unique, so different?
Well, they go way beyond just looking at your symptoms or your, current test results. They really dig into your family history, your lifestyle, and they use these high-tech diagnostic tools we were talking about to build a comprehensive, a really complete picture of your cardiovascular risk.
Okay, all right, let's talk about those tools. What kind of technology are they using? Give me the details.
Well, they're utilizing a range of imaging techniques. Things like calcium scoring and CT angiography.
Hold on. Let's just break those down for a second. I feel like I've heard of those, but I could definitely use a little refresher.
Of course. So calcium scoring, that's a non-invasive way to check for calcium buildup in your coronary arteries, which is a big sign of plaque and potential blockages. And then CT angiography, that gives doctors an even more detailed look at your heart's arteries. So they can actually see if there's any narrowing or blockages going on.
So they're literally looking inside your arteries for any early signs of trouble.
Precisely. And they don't stop there. They also utilize something called the Fat Attenuation Index, or FAI for short.
FAI, okay. What in the world is that all about?
This is where things get really interesting. So FAI, it analyzes the level of inflammation in the arteries surrounding your heart, which is often a big predictor of future heart problems. And then, to top it all off, they do these really comprehensive metabolic health assessments.
Okay, break it down for me. What does that involve?
They look at a whole range of factors, everything from your blood sugar control to your cholesterol levels, your blood pressure, even markers of inflammation in your blood. This might include glucose tolerance tests, continuous glucose monitoring, that's the CGM we were talking about, lipid profiling, and even testing for these things called proatherogenic proteins. Basically, these are substances that can encourage plaque buildup in your arteries.
Okay, yeah, I'm starting to understand why they call this a deep dive. It really seems like they're leaving no stone unturned.
Exactly. They're looking for even those tiniest little clues that could indicate a higher risk for cardiometabolic disease, even if you don't have any obvious symptoms yet.
So how does all of this actually translate into real-world results? Can you walk me through an actual patient case, an example?
Absolutely. SCVC actually shared this fascinating case study about a 64-year-old man who came in for an assessment. He had a few risk factors. He had a previous transient ischemic attack, basically a mini stroke, high LDL cholesterol, and a family history of both heart attacks and strokes.
Okay, so it sounds like he was already on the radar for potential heart problems then.
Yeah, he definitely was. And he was even already taking statins to help manage his cholesterol. But the clinic decided to dig a little deeper.
I'm guessing they found something a bit concerning when they did those advanced tests then.
They did. Even though this guy was a non-smoker, had normal blood pressure, the tests revealed some worrying issues. He had what's called extensive non-obstructive coronary artery disease. Basically, that means there was plaque building up in his arteries, but it wasn't actually causing any blockages yet.
So like a ticking time bomb kind of thing.
Yeah, you could say that. And his calcium scoring, that showed significant calcium buildup in his arteries. Another big red flag. His 8-year fatality risk, according to something called the Cotteri Heart Score, was a whopping 22.6%.
Okay, yeah, that's pretty serious. But you mentioned those metabolic assessments earlier too, right? What did those show?
And this is where those fancy tests really come in handy. His standard HbA1c test, that's the one that measures average blood sugar over time, was totally normal. But
there's always a but, isn't there? What did they find?
His continuous glucose monitoring, CGM, it revealed something that the HbA1c completely missed. He was having these significant glucose spikes throughout the day, especially after meals.
So even though his overall average blood sugar looked fine, it was actually spiking up and down.
Exactly. And those spikes, they're really important because they can damage your blood vessels over time. And that increases the risk of all sorts of heart problems down the line. Remember what we were talking about earlier? This is a perfect example of how someone can have underlying glucose dysregulation that just wouldn't show up on those standard tests.
Wow, this is a textbook case. Really drives home how important it is to look beyond the surface, to take this kind of comprehensive approach to cardiovascular health.
Couldn't agree more. This case really highlights the power of early detection and the importance of using the right tools to get that complete picture of your health.
So what did SCVC do with all this information? How did they actually help this patient?
Well, they put him on high-dose statin therapy, to really aggressively lower his LDL cholesterol. They recommended a lower glycemic diet, basically cutting out those high-sugar foods that were causing those blood sugar spikes. And they also adjusted his blood pressure medication based on some ambulatory blood pressure monitoring they did.
So a multi-pronged attack addressing all the risk factors they uncovered. And I'm assuming it worked.
It did. Through these targeted interventions, the patient was actually able to significantly reduce his cardiovascular risk. And more importantly, he gained some really valuable insight into his metabolic health in the process.
That's fantastic. So it's not just about identifying those risks. It's about taking those concrete steps to actually address them head on.
I gotta say, I'm really impressed with SCVC and their approach. Are there any other services they offer that go beyond these, the assessments and the personalized plans?
Oh, there are. And we'll dive into those in detail next time.
Well, then I can't wait to hear more. Yeah, so they offer a bunch of different services, all aimed at, improving metabolic and cardiovascular health. One that's particularly interesting is medical nutritional therapy.
Nutritional therapy. What exactly does that mean?
Basically, it involves working one-on-one with a registered dietitian, and they help you create a really personalized eating plan that specifically targets, your individual metabolic needs. Remember, this is a cardiometabolic clinic. They really get how important food is for both your heart health and your overall metabolic function.
So it's not like just cutting calories or hopping on the latest fad diet. It's more about, understanding how different foods affect your body specifically, and then making choices that actually support your health.
Right. Exactly. Exactly. And, thinking back to that case study we just talked about, where that patient had those hidden glucose spikes, this type of personalized nutrition plan could be incredibly valuable, especially for people who might have that carbohydrate sensitivity. Tailoring their diet to really minimize those spikes can make a huge difference in preventing things like diabetes and heart disease.
Yeah, that makes a lot of sense. What about other services? Anything else stand out that they provide?
They also offer what's called GLP-1 agonist therapy. That's a newer class of diabetes medication, and it's shown some really promising benefits for heart health as well. They actually have a dedicated nurse-led program to help patients understand these medications and make sure they're getting the right dosage and everything.
That's great to hear, because sometimes, getting access to those newer medications can be a bit tricky. What else do they offer?
Well, they have a wide range of pharmacotherapy options. Other medications like SGLT2 inhibitors, metformin, and these insulin sensitizing agents. Basically, they're all tools that they use to manage things like blood sugar, cholesterol, and other metabolic factors.
Okay, sounds like they've got all their bases covered when it comes to medication management. But, I'm curious, what about the lifestyle side of things? We all know diet and exercise are important, but let's be real, they can be tough to stick with. Do these clinics help with that too?
Absolutely. And, this is a really critical point. SCVC doesn't just rely on medication and fancy technology. They really emphasize that lifestyle changes are, they're the foundation, the cornerstone of long-term cardiometabolic health.
So it's more of a holistic approach.
Exactly. They actually bake those lifestyle interventions right into their treatment plans. So personalized nutrition plans, which builds on what we were talking about with the medical nutritional therapy, exercise programs, and they even offer behavioral coaching.
Behavioral coaching. Okay, tell me more about that. I'm intrigued.
So think of it as like extra support and guidance to help you make those lasting changes to your habits. It's not just about, willpower. It's about addressing the psychological and emotional aspects of making those big lifestyle changes.
Right. Because it's one thing to know what you should be doing, but actually putting it into practice consistently, well, that's a whole other story.
I know, right? It's all about creating that sustainable change, not just those quick fixes that don't last.
Okay, I'm super impressed with SCVC and everything they're doing.
Yeah.
They're really, raising the bar when it comes to preventative cardiology. But let's zoom out for a sec. The research we've been looking at mentions that this need for cardiometabolic clinics, it's not just a UK thing, it's a global trend, right?
Oh, yeah, you're spot on. And there's this really startling statistic from an article out of the National Library of Medicine. It says that almost 500 million people are living with diabetes worldwide.
Whoa. That's a mind-blowing number.
It is, right. And it's not just diabetes. The rates of obesity, which is a major risk factor for type 2 diabetes, have also just skyrocketed in the past few decades.
So basically, we're looking at this huge global health crisis, and cardiovascular disease and these metabolic disorders, they're right at the center of it.
Yeah, that's the unfortunate reality. And that's why these cardiometabolic clinics are becoming so crucial. They're offering this, proactive, preventative approach, addressing these issues before they turn into full-blown emergencies. It's like a shift from reactive care to proactive health management.
Yeah, I like that analogy. It's like building a dam upstream to stop the flood from even happening instead of just scrambling to react once the water's already rising.
Precisely. And the article really emphasizes that these clinics aren't just about all the, fancy technology and the medications. They're also really focused on those lifestyle interventions we were just talking about because, diet, exercise, even your mental well-being, they play such a huge role in cardiometabolic health.
So it's about giving people the knowledge, the skills, the support they need to make those lasting lifestyle changes, to become active participants in their health, not just, passive bystanders.
Absolutely. It's about making people the drivers of their own health journey, not just passengers.
And speaking of knowledge and skills, the article also talks about how important it is to have a well-trained healthcare team at these clinics.
Right. Oh, yeah, definitely. You need people from all these different specializations working together really smoothly to give the best possible care. It's not just about having a cardiologist and an endocrinologist. It's about having a whole team that includes nutritionists, exercise physiologists, psychologists, even genetic counselors sometimes.
Wow, that's quite the team. So what's the reasoning behind having such a diverse group of experts?
Because we're talking about addressing this complex interplay of things like your genes, your lifestyle, the environment, all these factors that contribute to cardiometabolic disease. And, it's not just about treating the symptoms. It's about really understanding the root causes and creating a personalized plan to actually address those.
Yeah, I'm noticing a pattern here. It all keeps coming back to that personalization, right? Tailoring the treatments to each person's unique needs and their situation.
You're picking up on a really key theme here. Because personalization, that's the future of medicine. And these cardiometabolic clinics are really leading the charge.
That makes total sense.
Yeah.
But personalized medicine, it can be expensive.
Right.
How accessible are these clinics really for the average person?
Yeah, that's a valid question. And it's something the article definitely addresses. There are definitely challenges when it comes to cost and accessibility. But more and more people are recognizing that investing in preventative care can actually save a ton of money in the long run. Because, you're reducing the need for those really expensive treatments later on.
So it's not just about individual well-being. It's also about, the sustainability of our healthcare systems overall.
Precisely. And there's a lot of work being done right now to push for more insurance coverage for these types of services and to find ways to make them more efficient and cost-effective. The goal is to make these innovative treatments available to everyone, not just those who can afford it.
That's a super important point. Healthcare should be a right, not a privilege.
Yeah.
What about other challenges these clinics are facing? What else does the article mention?
It talks about the need for more training and education in this field. In cardiometabolic medicine, we need more healthcare professionals who are really equipped with the knowledge and skills to provide this type of, comprehensive care.
So building a workforce that's actually ready to meet the growing demand for these specialized services.
Exactly. We need to invest in education and training to make sure we have enough qualified professionals to staff these clinics and provide really high-quality care.
Sounds like there's a lot of work to be done, but also, a lot of exciting potential in this field, in cardiometabolic medicine.
Oh, yeah, definitely. I mean, we're still in the early stages, but the progress that's been made in just the last few years is pretty incredible.
And with clinics like SCVC kind of leading the way, I'm feeling pretty optimistic that we'll keep seeing those breakthroughs in the years to come.
Oh, me too. Me too. The future of cardiometabolic care is really bright, and it's all about giving people the power to take control of their own health and live their best lives.
So we've talked about why these cardiometabolic clinics are so important, the benefits of that multidisciplinary approach, the whole early detection thing, the role of personalized medicine. But what about the actual services these clinics offer? Can we dive into those specifics a little more?
Oh, yeah, for sure. The article actually gives a great rundown of the different services you typically find at a cardiometabolic clinic.
Lay it on me. What's the deal?
Well, first and foremost, they offer those comprehensive metabolic health assessments we were talking about. Those might include blood tests to check your cholesterol, blood sugar, other metabolic markers, and then also, the advanced imaging techniques to really assess your cardiovascular risk.
So it's kind of like a full diagnostic workup,
Yeah,
but specifically focused on your cardiometabolic health.
exactly. That's it. They also usually provide that medical nutritional therapy we were talking about earlier, working with a dietitian to create that personalized meal plan that's going to support your metabolic goals.
So again, not just about cutting calories or following some random fad diet. It's about truly understanding how those different foods are impacting your body and making choices that, are actually nourishing your health.
Yeah.
Especially when it comes to managing things like that carbohydrate sensitivity.
Yeah, exactly. And a lot of these clinics offer those specialized medication management services, things like the GLP-1 agonist therapy, other newer medications that have shown really great benefits for cardiometabolic health.
Those are the ones that not only help control blood sugar, but also have those protective effects on the heart, right?
You got it. And they often have those dedicated teams, to help people navigate those medications, making sure they're getting the right dose, the right monitoring, that kind of support.
Yeah, that's crucial because some of those meds can be pretty complex. It's important to have that expert guidance to make sure you're using them safely and effectively. What about the non-medication stuff, the other approaches?
Oh, yeah. Beyond the meds, a lot of these clinics offer those lifestyle interventions we talked about. So personalized exercise programs, behavioral counseling, even stress management techniques.
Taking that whole holistic approach, right? Addressing not just the physical stuff, but also the mental and emotional factors that play a part in your health.
Exactly. Recognizing that our health is, it's multifaceted. True well-being comes from addressing all those different aspects of our lives.
I love that approach. It's so much more empowering than just focusing on, treating symptoms. It's about giving people the tools and the support they need to really thrive.
And that's ultimately what it's all about, right? Empowering people to take control of their own health and live longer, healthier, and more fulfilling lives.
Couldn't have said it better myself. I'm feeling really inspired by all this. But before we wrap things up, can we chat a bit more about the future of this whole cardiometabolic care thing? What's on the horizon? What's coming next?
Ooh, the future is full of exciting possibilities. We're seeing some incredible advancements in imaging technology, in the world of pharmacology, and of course, in personalized medicine.
Okay, give me the specifics. What innovations are you most excited about? What's got you buzzing?
Well, one area that's super promising is the development of these real-time metabolic assessments, where people can actually track how their metabolism is responding to different foods and activities, all in real time.
Whoa, that would be a game changer. It would be like having a personal metabolic coach right there in your pocket.
I know, right? Imagine being able to see exactly how your blood sugar reacts to a specific meal or how quickly your heart rate recovers after a workout. This kind of instant feedback, it could revolutionize the way we think about making those lifestyle changes, especially for people with, carbohydrate sensitivity.
I can definitely see how that would be incredibly motivating and empowering. What else is coming down the pipeline?
Another area that's evolving like crazy is sophisticated lipid profiling.
Okay, remind me, what exactly is lipid profiling again?
It's basically a really detailed analysis of all the different types of fats and cholesterol in your blood. Traditionally, we've just focused on measuring total cholesterol, your LDL, your HDL, the good, the bad, and the ugly, right?
Right. But what's changed? What's different now?
Well, with these new technologies, we can actually zoom in and analyze the size, the shape, even the composition of these cholesterol particles. It gives us a way more nuanced understanding of your actual cardiovascular risk.
So it's kind of like we're looking at those microscopic details to get a much clearer picture of what's happening at the cellular level.
Precisely. And this level of detail, it lets us develop much more targeted and effective interventions.
Makes sense. So again, moving away from that one-size-fits-all approach and really embracing personalized medicine.
You got it. And this whole personalized approach is extending to pharmacotherapy too.
Ooh, okay, what do you mean by that?
We're seeing all these new medications being developed that actually target very specific pathways involved in cardiometabolic disease. So that means we can really tailor the treatments to each person's unique genetic and metabolic profile.
So instead of having this one drug that's supposed to work for everyone, we're moving toward these treatments that are as individual as the people they're meant to help.
That's the dream. And with all the advancements in genomics and precision medicine, we're getting closer and closer to that dream becoming a reality.
Okay, I gotta ask. With all these incredible advancements happening, what do you think the future holds for those cardiometabolic clinics themselves? What's in store for them?
Well, I think we're going to see a continued shift towards that preventative care model.
Yeah.
With these clinics really taking center stage in managing people's cardiometabolic health.
So they'll become more like almost wellness centers.
Yeah.
Helping people optimize their health before any problems even pop up.
Exactly. There'll be these hubs of innovation, offering the latest diagnostic tools, personalized treatments, ongoing support, all to help people achieve and maintain that optimal level of health.
And with technology, changing so rapidly, I imagine these clinics are going to become even more integrated, more connected.
Oh, yeah, for sure. We'll probably see a huge rise in things like telemedicine and remote monitoring, so people can access that care and support right from their own homes.
That's fantastic, because that breaks down so many barriers, makes preventative care way more convenient and accessible to everyone.
Absolutely. When you think about the future of cardiometabolic care, it's all about personalization, prevention, and empowerment.
I love it. It's a future I'm definitely excited to be a part of.
Me too. And with all these dedicated clinicians, researchers, and innovators out there working hard, I'm really confident that we're going to keep making incredible strides in the years to come.
All right, listeners, we've just taken you on a whirlwind tour of the world of cardiometabolic clinics. And I think it's safe to say we've learned a ton.
Oh, we've covered a lot of ground, from the basics of cardiometabolic health all the way to the cutting-edge stuff that's shaping the future of how we approach care.
But before we officially wrap up this deep dive, I want to leave you with a few key takeaways.
All right, hit me with them, those pearls of wisdom.
First and foremost, remember that cardiovascular disease and metabolic disorders, they can be silent killers. They can develop for years without any obvious symptoms.
So don't wait until you're having problems to finally take action.
Exactly. Be proactive about your health.
Yeah.
Get those regular checkups. Talk to your doctor about your risk factors.
And, if you have any concerns, don't hesitate to seek out some specialized care at a cardiometabolic clinic.
Because these clinics, they offer that multidisciplinary approach. They bring together all those different specialists to provide that really comprehensive, personalized care.
And they're using the latest and greatest in diagnostic tools to figure out your risk and come up with a treatment plan that's tailored just for you.
And they really emphasize how important those lifestyle interventions are. They give you the power to make those changes that are actually going to stick, those changes that support your long-term health.
Remember, your health, that's your most valuable asset. Invest in it wisely.
Well said. And as we've learned today, the future of this whole cardiometabolic care thing, it's looking pretty bright, with so many exciting advancements on the horizon.
So stay informed, stay curious, and most importantly, stay proactive about your health.
And with that, we'll wrap up this deep dive for today. Until next time, keep learning, keep exploring, and keep striving for that healthier, happier you.
It's interesting. We've been talking about all these clinics and technology and treatments, but when you really get down to it, it all comes back to the individual.
You mean like the patient, the person in the center of it all?
Exactly. You're the one in the driver's seat of your health journey, right? You're the one making those choices every day that really impact your well-being.
So it's not just about like blindly following the doctor's orders. It's more about actively taking part in your own health.
Absolutely. It's about taking ownership, being informed, making those conscious decisions that really align with what's important to you, your values and your goals.
Yeah, that's really empowering. It means we're not just stuck with whatever our genes or our circumstances throw at us. We have the power to actually make a difference.
And that's what really drives change, that sense of agency. That's what helps you move from a state of, just dealing with disease to actually achieving true well-being.
So this deep dive, it's not just about cardiometabolic clinics, is it? It's about a bigger shift in how we think about our health.
You hit the nail on the head. It's about realizing that we're not powerless. We have the ability to shape our own health destiny.
And it starts with taking that first step, seeking knowledge, asking questions, and speaking up for ourselves, advocating for our own health.
And remember, you don't have to go it alone. There are so many amazing resources out there. Clinics like SCVC, support groups, online communities, and of course, a whole army of healthcare professionals who are dedicated to helping you thrive.
So let this deep dive be that little push you need, that spark that ignites your passion for health and well-being.
Get out there, embrace that power you have, and create a life that's vibrant, joyful, and full of energy.
That's a perfect way to wrap things up. Thanks for joining us on this exploration of cardiometabolic clinics and the future of heart health.
It's been a pleasure sharing these insights with you.
And to all our listeners, we hope you've gained some valuable knowledge today and maybe even a renewed sense of possibility when it comes to taking control of your own health. Remember, knowledge is power. You now have the tools to make those informed decisions and start on your own journey towards a healthier, happier you. Until next time, stay curious, stay informed, and stay well.